Welcome to the final part of our NHS West Yorkshire Integrated Care Board meeting here in Wakefield today. Hello, my name is Cathy Elliott and I am Chair of the Board. We're now in the final part of our meeting today. We're going to be looking at planning guidance, which is particularly relevant for this new financial year starting on the 1st of April for NHS, but working with the breadth and depth of the health and care sector. And then we'll be looking at some key items and signing off documentation together. So I want to ask Adrian and Lou to talk to us about, if you give us an overview of the planning guidance documents, please. Lou, do you want to start us off? Thank you.
I think actually it's over to Adrian, who's going to give us an outline. Thank you.
Oh, OK. Let's swap the order. Adrian.
Yeah, no problem. Thank you very much. Yeah, so as you say, Lou, I'm just going to... The paper's kind of for information, really, just to outline some of the key documents that have been published. They're all in the public domain. They're all on the NHS website. They're all there available for anybody to have a read. But this paper is just to kind of summarise them. Just to talk a little bit about how they apply to West, or how we've applied them in West Yorkshire and what our planning approach is overall. So I'm not going to give a financial overview per se, I'll just give a general overview, and then if there's anything at the end, Lou, that I've missed, if you could maybe chip in and help out that would be great, thank you. So just in terms of what the paper contains, as I said, there's an overview of the planning guidance overall. It did come out some significant time ago now, or it feels like it, probably not, but sort of January sort of time is when it came out. There's been a lot of work on plans since then, both from a financial perspective and a workforce activity and performance perspective. The paper references all the key documents that are on there. It also references the 7 national priorities that we need to stick to as part of that we need to stick to as part of that overall approach to delivering the plan. I won't go through all of them. They're probably well rehearsed by now. I think the key thing, though, to note is that there's a clear expectation that we have to deliver all of our required performance and constitutional standards within the overall resource allocation that we've been provided, so sometimes referred to as living within our means. Different terminology is being used across the board, but that's essentially a summary of what we need to be able to make sure we're doing. As at the headline submission, so we had to make a headline submission to NHS England on the 27th of February. We're not quite there yet, so the financial plan that we submitted wasn't in line with the expectation that would deliver a break-even position. We have been doing a lot of work across the system since then, just to both with organisational reviews, place reviews, system reviews, just to try and understand what our opportunities might be, how we might be able to get there, what kind of approaches we might need to take to be able to deliver a balanced plan. We've been working closely with NHS England on that, so they've been partners to all of our discussions. They've been involved in all those discussions, which has been a really helpful piece of the puzzle. As I said, there's a number of supporting documents in the paper that I won't talk through in any level of detail, but they're there for people to have a look at. In terms of the planning approach that we've had that we're following the initial submissions, as well as the finance discussions that I've mentioned. We've had the mutual accountability peer review discussions that Lou's team's been leading on. And the expectation now is that we submit the final plans on the 27th of February, but there's a little lead into that. There's still a few days left between now and then, and most of the focus of the work is to try and make sure that we can get to the point where we've got that balanced plan in the context of still delivering our overall performance and activity targets, etc. So the recommendations for here really just to note where we've got to, note the priorities in the paper, note the planning approach that we're taking in West Yorkshire, and note that the final submission is on the 27th. So that's just a very quick canter through the paper. There's a lot of, as I said, there's a lot of information behind elements of this paper, but if there's anything, Lou, that you'd like to, if you think I've missed anything.
Thank you, Adrian. Just, I suppose, to add that we will be also putting in as part of the assurance process some board assurance statements to sort of describe how we've worked together as a partnership, how we've jointly done the plans, we understand how they operate, what we've all got to deliver within them, the risks within that, and that will be part of the sign-off process on the 26th of March before the plans are submitted on the 27th. Thank you.
Lou, thank you very much. And we also welcome the inclusion of integrated neighbourhood teams and laying the foundation of the integrated neighbourhood healthcare. I've said it a few times today, but I think that's really good to have that in our planning guidance. And I know place committees, place partnerships are working on that together. 6 key core components, which I think is really helpful to enable any system in any place in England to make that happen. So I think that's really welcomed and very fitting with what we're already doing, including our integrated neighbourhood teams blueprint as well, and our place system arrangement reviews. Are there any questions at all on that? Board members, do you feel assured we're on a good footing here, but then also we continue to be agile and respond to announcements last week, as well as our own work and plans, including we go back to the PwC review we had invited last year, which will continue to feed into our work as well through our provider collaboratives and places. Okay, I will take silence as agreement, so that's great. Thank you, Lou and Adrian, and to everyone who's working on that at the moment. Lou, we then have emergency preparedness, resilience. I never get this in the right order. EPRR. Go on, you go. This is an annual report on EPRR.
Okay. I'm the interim director for planning and performance, but I also have a role as the accountable emergency officer. So I'm bringing the emergency preparedness, resilience, response annual report. I had to read it as well myself to the meeting. It's a requirement that ICBs, as part of our core standards, that we publish an annual report setting out all of the key activities that we've undertaken in relation to the duties and responsibilities that we have as a Category 1 responder. So this is what's the content of the report. Some of the annual report might be familiar because we did bring it a couple of meetings ago in terms of the section on core standards, where we went through those and we signed those off. And I think what we're asking the board to do is to actually accept the EPRR annual report for publication as part of the board papers.
Thank you, Lou. And we know, I've just sort of pulled out a few things. We know the training that's been attended, exercises that have been run or attended. We know that was a sort of key part of work. The incidents that have taken place in the system, unfortunately, but the response to that, where we think about civil unrest last summer or industrial reaction in action as well. So a whole array of work, which also illustrates to someone who's maybe not familiar with this, the kind of work that takes place and the responses required. So, colleagues, do you have any questions at all? Are you happy to support the report and publication? Great. Thank you. Lou, as you said, this is a regular reporting on this. I know, Anthony, you've shared previous reports for us, and our compliance continues to grow, which is welcomed, but we've still got further to go, so we welcome future reports on improving our compliance with the standards. Jane?
Yeah, sorry, Kathy. I was just interested as to where the lessons learnt from the various exercises go. Is it a series of different committees that see those, depending on the nature of them, or how is that captured, please?
We tend to take them into some of the more operational leads meetings and also use them to help support the on-call, people who are on the on-call rotas, because there's nothing like a practical example of something and how we should respond. But that would be the main places that we would take them. Unless Anthony, I can see at the end of the table, is thinking they might want to add.
Yeah, thanks, Lou. If I could just briefly add to that. I agree with what Lou's just said, but there's also the sort of partnership dimension of how we learn lessons from incidents. So the ICB is a member of West Yorkshire Resilience Forum, the multi-agency partnership, which does a lot of formal debriefs when significant incidents take place. So, for example, there's been a recent debrief on the civil unrest in Leeds last year. Debriefing and learning lessons from incidents like that is a really important part of how we collectively learn as a partnership how to improve our collective response and preparedness. So the Resilience Forum and its related sort of subgroups is a really important mechanism to allow us to do that.
I just wondered if we could have some high-level themes from the different things that happen or incidents that have happened or training that you've done to sort of give some flavour to this report for board members as well.
I think that would be really helpful to do anyway. We do actually discuss different incidents in different groups, so we've got notes where we could sort of perhaps do a set of highlights from it, just to illustrate, but also to help inform others.
That would be great. And I think just when you talk about multi-agency, Anthony, I know what you mean. That's also working with the police force, isn't there? Fire service. So there's the breadth of response teams there and organisations. So thank you. And thank you, Jane, for that. It's always about trying to make sure that we're improving the content of what we're sharing in public. Okay. Thank you, Lou. So with that, suggestion. Are we happy to support the report? Rob?
Yeah, very, very happy. Just to confirm and clarify the action there, Jane. I think the annual report should include that summary of themes and, you know, how they've driven some of the improvements. I think that's what we're committing to.
Yeah, exactly.
Okay, so now we'll move on to item 22. It's been a long day, hasn't it, colleagues? Delegation of specialised commissioning services. Now, as a board, we've been receiving updates on this and the forthcoming delegation of specialist commissioning from April this year. You've been informed at board development sessions as well as board meetings by Ian Holmes. We touched on this in our board meeting in private this morning, but we are here talking about this in our board meeting in public. For those members of staff and public who are taking interest in the meeting, there is a lot of documentation there, so you can see what is being considered, particularly in taking on the value of £571 million worth of specialist commissioning services. Ian, would you give an overview and particularly an ask of the board today, because we're being asked to approve a number of things, but we also appreciate we're operating in a new context as of this week as well in the NHS.
Yes, thanks, Cathy. Hi, everyone. Ian Holmes, Director of Strategy and Partnerships and Deputy Chief Executive. There's a direction of travel that we're aware of from NHS England to delegate commissioning of services to ICBs. It's a direction of travel that we support. We think it's in the best interest of people in West Yorkshire to take it on delegation of these services. It allows us to join up planning of services across pathways. It allows us to work more closely with providers and provider collaboratives, and it allows us to have the right focus on improving outcomes and tackling inequalities in the work that we do. So we're supportive of this direction of travel, and that isn't changing. When we had the conversations last year, we described the approach that we were taking to managing this. We set up a programme board chaired by Phil Wood, who's the Chief Executive at Leeds Teaching Hospital, and we set up 6 work streams that would oversee and manage the work that we needed to do to manage this delegation. There's been significant work done since then. Really well supported by the 4 audit chairs across North Eastern Yorkshire, including Jane Madeley, who kind of got under the bonnet of the work that we were doing and worked with us to understand the risks and the opportunities around this delegation. And paragraph 4.3 sets out some of the work that we've done since we discussed this last to oversee the safe delegation of services. 4 important documents there. I don't expect you to have read those line by line. We've done that for you. There's a delegation agreement which confirms the formal delegation from NHS England to the ICB. There's a collaboration agreement between the 4 ICBs in North Eastern Yorkshire and NHS England, which describes how we'll work together in a bit more detail to manage this. There's a terms of reference for the joint committee across the Yorkshire and Humber ICBs, which is the vehicle we'll use to do the commissioning. And there's a transitional MOU, Memorandum of Understanding, for the first quarter of the next financial year, which is the period where we've got delegation, but we don't have the staff, so that manages that sort of interim period. We're also picking up changes in the scheme of reservation and delegation, the financial scheme of delegation, as part of the next item on this. So there's been a lot of work done on this around the governance, as well as understanding the quality risks, the service issues, and the financial and contracting position. And we feel like we're in a good place based on that to receive delegation of these services. We've also built pretty good relationships with the other ICBs, the providers of these services, and the NHS England team that we'll be receiving. So we feel like that all bodes well for the future. The significant development that we've touched on throughout the meeting since this paper was published is the announcement of the running cost reductions in NHS England and in ICBs. Clearly, that could have a material impact on the delegation agreement, which sets out the team that will do this work and how the operating model will function. And we are working with NHS England on a day-to-day basis to really understand the implications of this. It's a live issue. NHS England know that it's a live issue in the context of this delegation, and we're working to gain rapid clarity on what this means in terms of those staff who will transfer and how that 50% reduction will impact on it. So, given that that is still a little bit up in the air, what we're asking for today is support in principle for delegation, and that the board is assured that we've done the appropriate work to receive delegation of these services, and probably a request of me potentially working with Jane and others to continue those conversations urgently with NHS England to try and get as much clarity as we can. As I said earlier on, this is a direction of travel that we support. We think this is the right thing to do for these services, and clearly having certainty for the staff involved quickly is really important as well. But until we get that clarity, we probably can't recommend that we sign this off today. The final thing that I'd say is that this feels like the start of this process, and the work that we're continuing to do with the NHS England team is to develop a plan, a prioritised plan for the work next year around how we manage some of the services that are at risk, as well as how we deliver some of the improvements that we want to see around specialised commissioning, and that is really important, as is how we support the team coming across so that they understand our processes and they feel valued and supported in the transition that they'll hopefully be going through in July. So I'll pause there, Cathy. But...
Great, thank you very much, Ian. Could you just clarify, particularly it's helpful for me, the delegation agreement is with NHS England. We're expecting NHS England still to exist over a 12 to 20 month period, despite the announcement of them taking cuts and being absorbed into the Department of Health. So what are you recommending that we sign this agreement today, or what would you like to do if we're pausing? Can I just check? I'm
recommending that you're supporting in principle that we've done the work to receive delegation, and that you're asking me to have further conversations with NHS England around the staffing elements. I think the announced abolition of NHS England is probably not immediately material to these conversations, because it will be there for 2 years, as you say, and if and when it is abolished, the duties, as I understand it, would pass to the Secretary of State, which could then be delegated to ICP. So that I don't think that's a material issue. It's more about understanding how the 50% reductions on ourselves and NHS England will play out in the context of quite a large team transferring.
Thank you very much, and that is the immediate risk from the announcements last week in relation to this. Does anyone have any questions or comments at all around the table? We've been very well informed as a board over many months on this. It's a significant piece of work. Ian, I'm just going to ask a really simple question here, but 571 million is an enormous amount of money, but this is not new money, is it? I think for anyone watching and learning more about NHS work, could you just clarify that?
No, it's money that is currently held by NHS England, commissioned by NHS England, and it's money that is commissioned. Acute and mental health providers are commissioned through that money, so it's not new money. It's a change in the commissioning responsibilities for that money.
That's really helpful. Thank you very much. Okay, so Jane.
Yeah, I was just going to confirm that up until recent NHS announcements, then certainly the regional audit committee chairs have been well briefed and assured by the work that's been ongoing. And just to really offer, we've got the three of us have got an informal networking meeting scheduled for Friday of this week, so I can test with others kind of the discussion we've just had in terms of what happens if we don't get clarity or confirmation of that resource moving, etc. So if that's helpful, I can touch on it then.
That is helpful. If it's helpful for one of us to join that, Jane, then we could manage that as well.
Okay, so we've got two specific actions in engaging with other ICBs in our region, because we're jointly working on this with them and they have their own delegation coming to them, and then also clarifying with NHS England. AC, did you want to come in?
Yeah, just quickly, and I think it makes sense in terms of how you explained this, and I was reading through all of the headings. It'll take at least 12 to 24 months to change any of those in consequential nature, but it'll follow through. In terms of the immediate risk then, which is a real risk, how do we mitigate that, given what the announcement, I know we don't have the information, but at least from our perspective, to take on this from 1st of April without the necessary workforce that you need, how do we take this through governance and approval? Because we understand that we are waiting for that information, so we don't have a board before that.
No, so do you want me to come back in, Cathy? Apologies. So I think there's a scenario where we get the assurance that we need, and NHS England can tell us that the staff that transfer will transfer, and then in which case I think we're saying we can approve this on the basis that that's what's already been agreed. if that isn't the position by the end of March, I think there's a conversation with the other ICBs and NHS England about whether we extend the transitional arrangement. We've got a transitional arrangement now, we've got a shadow joint committee, and one option might be to extend that for a period until we get clarity around the staffing implications. But like I say, the conversation I had with it, I spoke to NHS England every day since the announcement. This is a live issue that they're working through, and we just need to continue day to day to try and get clarity.
Jane?
I was just thinking, we do have the special board meeting next week around the plan, so there's certainly, I think AC and I are both due to attend that, so that'll be a useful point to update, depending on where we get to today in terms of approval.
Thank you. So that meeting next week that's been referred to is an urgent decision meeting where Chair and Chief Exec with some execs and non-execs can meet together, taking delegation from the board. So we can add that to the agenda. I was just checking in with Laura. If you remember when we first looked at this with Phil Woods, we had an extraordinary board meeting on MS Teams. So that is another option for us. And I think Laura and I were just saying if everything goes to plan, it is as it is, then I'm assuming, but I want to check with you that we all support this in principle, but if there are any material changes, then we need to come back, check in with each other, which may lead to an extraordinary board meeting. Rob?
Yeah, I think that's really helpful. We've got agreement in principle, I think, haven't we, subject to that confirmation. Just, Ian, do you want to confirm that this has no detrimental or immediate impact on the mental health spec-com arrangements through the provider collaborative? Do they continue as they are? So it's just that we're doing the commissioning end of that.
Yes, so the mental health arrangements that we've got is that NHS England is the commissioner, but there is a lead provider model across West Yorkshire. That would continue if the service wasn't delegated. If the service was delegated, that would continue as well.
Thank you. Ian, thank you for your work on this. Again, being so agile over the last few working days, it's really, really appreciated. I think something I just wanted to note is, as Phil Wood, Chief Executive Leeds Teaching Hospital, but has been a key person in working with you on this, came to our extraordinary board meeting in relation to this, that I'd encourage the board and my successor to invite him as an attendee as required to the board meetings to be part of these discussions, whether it goes as we expect at the moment or it changes. And I think, Ian, if you can then keep us informed on this. Just a few people are coming to this brand new. Why are we doing this? Why is it important that we take this on and have the delegation?
Yes, I think the principle for us is that having whole NHS budgets for populations at a geographic level is the right thing to do. I think one of the features of the previous legislation was that it fragmented commissioning responsibilities. So NHS England had some commissioning responsibilities, CCGs did, and local authorities did at the time, and having those different arrangements makes it harder to plan for whole populations and integrate services. This reflects the direction of travel that's been happening a number of years. So pharmacy, optometry and dental was delegated 2 years ago. I think we've been able to demonstrate that we've been able to make some improvements with that. Screening and immunisations is due to come in a year's time. Again, we'd hope that we could make some improvements to that. So the concept of having whole budgets for whole populations is helpful in the context of integrating services and improving outcomes.
Thank you. Just a reminder why we're doing this as we then get into hundreds of pages of documentation. Ian, thank you so much for your leadership on this and working with so many colleagues. So round the table, we are agreeing in principle where we are now. But if we can see any material risks or changes, then we'll call the board back together. Either it's be a briefing or it may even be an extraordinary board meeting if we need to anything substantially change. Ian, thank you very much. Okay, and Jane, thank you for your oversight as well. So we've got two more items on our agenda with Laura. So one is the 23 and the changes to the scheme of reservation and delegation and financial scheme of delegation. I said that right, didn't I? And then we'll come on to item 24, which is the modern slavery statement. But 23 relates with what we just talked about. Is that right, Laura?
Yes, that's right. So in order to be able to enact the delegation of specialised commissioning, we need to make a number of amendments to our scheme of reservation and delegation and our financial scheme of delegation. These have all been reviewed by the Finance, Investment and Performance Committee and also by Audit Committee members who are supportive of the changes. We are also taking the opportunity to make a very small number of changes that are needed to support the previous delegation for pharmacy, optometry and dental. So we're just taking the opportunity to do that at the same time. So the board is being asked to approve those changes, and I think we'd add on to that subject to the delegation being received in light of the discussion for the last item. Thank you.
Great. Colleagues, are you happy to support that? Yeah, nods around the table. Thank you very much, and thanks to the governance colleagues and working with others on making that come together. Number 24, modern slavery statement, Laura. This is for approval.
It is, thank you. Yes, I'm really conscious this is at the end of a very long agenda, which doesn't reflect how important it actually is necessarily. So this is a requirement for the ICB. This is the second year. You'll recall it 12 months ago. So we are required to publish a modern slavery statement each year, and that statement sets out a very clear outline of our commitment and our efforts to prevent slavery and human trafficking practices in our employment and in our supply chain practices. So the statement has been reviewed by Quality Committee en route to board, who endorsed it. They also made a couple of suggestions for us to look at over the next 12 months. So one around reviewing the training that is provided to staff around this, and also how we can evidence that the actions that are contained within the statement work in practice. So that's something we'll look at over the next few months. So yes, looking for approval, please.
Colleagues, are you happy to approve that? Yes, nods around the table. Tim, then Rob, before we get to approval.
Yeah, welcome and very happy to approve. I think one of the things, it's one of those where you can nod it through and approve it. I do think as finance is tight, particularly I'm working with small independent sector providers in the care market, we need to be really on top of this one because that is a danger and a risk that I think is potentially growing. So that's all I wanted to add, but I fully support it.
Thank you very much. A key principle there. Rob?
In the same vein, I think Tim makes a really good point. I was going to suggest that as we review contracts, which we are actively doing at the moment to make sure they're delivering best value for us, it says in the statement that we will assess this periodically. We assess this with people who we have contracts with on contract and then assess periodically. I think there's a good opportunity as we're going through conversations with people about the value of those contracts and whether we can renegotiate that we are reinforcing and testing this modern slavery element of it.
Thank you. Great. So it's agreed action coming out of that as well. So we're happy to approve? Yeah. Great. Thank you very much. Does anybody have any other business? No? Okay. So some reminders of some key dates. Our next quarterly Integrated Partnership Board meeting, so that's coming together of local authorities, Combined Authority, Mayor Braben, NHS and voluntary sector, is on the 1st of April in Kirklees. We have made consideration. We know that Easter will be coming up, Eid will have just happened, but we're making sure that it is set at the right time. We've also had to take in considerations around council meetings as well and leadership meetings. So we've done our best to make sure as many people in our health and care partnership can attend that meeting in Kirklees. And we'll also have a gathering of provider board chairs that morning as well. So I know hopefully some of you as senior leaders can come and join that to talk to them. We then have our board development session towards the end of April. We've referenced it a number of times. It will still go ahead. We recognise that there's a national NHS England meeting in London that day for chief execs of ICBs and provider trusts, and we just ask that we make sure that we've got deputies and representation of board members. And then the next board meeting is on the 24th of June, when you'll have your acting chair, not me, in place. And anyone who would like to submit a question in relation to that day's agenda needs to submit that the morning before on the 23rd of June, and documents will be in the public domain by the 16th of June as well. So as I said, this is my last board meeting in public, but I'm around for a good few weeks or so. But thank you, colleagues, for everything. Amazing things we have achieved if you think we're only 3 years old as an organisation. And someone said to me, you're going to manage a board of 24 people. That is enormous. But we all work together really constructively. I think we've had great, robust conversations in private and public today. Thank you so much, because you're all striving and committed to make sure that we're delivering good quality services and support to the people of West Yorkshire. It's the reason why I wanted to come and work here as well. So thank you so much. There is so much more to do, but just think also about what we've achieved together over the last 3 years in forming a brand new organisation from scratch, and we've achieved so much together. So thank you for your support of me and of each other. It's fantastic, and it was a real privilege to work in West Yorkshire. Thank you, Rob, for your support. I'll make a bigger speech in a few weeks' time, I think. But colleagues, this is fantastic work, and we've just got to keep communicating, supporting each other, challenge constructively of each other, because we'll get the best results for our communities and our residents as well. So thank you. Ramadan Mubarak to anyone who is currently fasting at the moment, and we'll be celebrating Eid soon as well. And I hope you all get some sort of break soon as well, because this is a really challenging time, and so we need you fit and well for the challenges ahead as leaders in our health and care system. So thank you very much. That is the end of our board meeting today, and thank you, colleagues, for your preparation and your contributions. Much appreciated. Thank you.